What do VA and the administration hope to accomplish with these mental health summits?
Meeting the health care needs of veterans and their families is one of our highest priorities. We've been expanding our own resources to do that, but we also need to be collaborating and coordinating with our community partners. We need to engage local, faith-based, and nonprofit groups, veteran service organizations, community health centers, and others in providing the best possible mental health care and services to our veterans and their families. We're already successfully collaborating with community partners to help us reach our goal of ending homelessness amongst veterans in 2015. And we believe we can achieve similar results with mental health care. Just as homelessness is an issue that's too big and too complex to tackle on our own, we can't fully address the mental health care needs of veterans and their families if we're not working hand in hand with local communities. That's what these summits will help us accomplish.
What information and resources might a veteran obtain at one of the summits?
We're strongly encouraging facilities to invite veterans and their families to these summits. For veterans, these summits are an opportunity to learn more about programs and services that are available to them through the VA, as well as the resources that are available to them in the community. It's important to remember that the majority of returning service members successfully readjust to life after deployment. But for those who need help, it's imperative we bring our combined resources to bear in providing the care and supportive services they need, deserve, and have earned. We need to do all we can to raise awareness of the resources available to veterans and get rid of the stigma around seeking mental health care. We want veterans to know that seeking treatment for invisible wounds of war isn't a sign of weakness, it's a sign of strength.
What is the reasoning behind holding a summit at each of VA's medical centers?
Hosting these summits gives each of our medical centers a chance to sit at the same table with community partners, to listen to each other, and to learn from each other, and to build trust. Some communities are already working well together. They're meeting regularly, keeping each other informed, and coordinating services. They're making sure that the needs of veterans and their families are being met. Other communities have wonderful individual programs, but they're operating in isolation. These communities will really benefit from the opportunity these summits provide to bring everyone together to support veterans. But regardless of the starting point, we can all do better. Our intent is that these summits will start a dialogue that will lead to greater collaboration between VA and the many community organizations that help veterans make a successful transition into civilian life.
VA recently met the administration's goal of hiring 1,600 mental health professionals in less than 9 months. What does this mean for our veterans? How will they benefit from this?
Last year, we provided specialized mental health care to more than 1.3 million veterans. That number has been rising every year, mostly because we've improved our screening processes to identify veterans who may be in need of mental health services. Reaching that hiring goal and filling more than 2,000 existing vacancies means that we can better meet the needs of veterans. We now have a workforce of more than 20,000 mental health professionals nationwide. It's the largest mental health program in the country and one of the largest in the world. I'm proud of all the hard work our staff did to get these positions filled, but that doesn't mean we're slowing our efforts. We'll continue actively recruiting to fill any vacant mental health positions. We need to make sure that veterans can get the care they need when they need it, where they need it.